What happens in the first minutes after birth? First cry and baby's first breath. Hello parents, welcome to BARMed. My name is Dr. Bardhil Idrizi. I am a pediatrician with more than 20 years of experience, and I have a master's degree in clinical medicine. Today I will explain something very important and interesting. What happens in the first minutes after birth, and why the baby's first cry is so important. What happens in the first minute of birth? When a baby is inside the mother's womb, the baby does not breathe with the lungs. The baby receives oxygen through the placenta, the umbilical cord. The lungs are filled with fluid and are not active yet. The first breath, a big change for the baby. The moment the baby is born, the baby must suddenly do something new. Start breathing air through the lungs. This is one of the biggest changes in human life. In the first seconds after birth, the baby takes the first deep breath. The lungs open. The fluid inside the lungs begins to clear. Oxygen starts entering the blood directly through the lungs. Why does the baby cry? The first cry is not only emotional, it is a medical sign of health. The cry helps the baby to open the lungs, push fluid out of the airways, increase oxygen in the blood, improve circulation and heart function. So the first cry is like the baby saying, "My lungs are working." What happens to the heart circulation? Inside the womb, the baby's blood circulation is different. After birth, special fetal openings in the heart start to close. Blood begins to go to the lungs to get oxygen. The heart and lungs start working together normally. This change happens quickly, in the first minutes and hours. Why do some babies look blue at the beginning? It is normal that some newborns look slightly bluish in the first moments, especially hands and feet around the mouth. This happens because oxygen levels are still adjusting. Within minutes, as the baby breathes better, the skin becomes pink, the baby becomes more active, breathing becomes regular. What happens after the first cry? After the first cry, oxygen level rises fast, heart rate stabilizes, brain receives better oxygen, baby becomes stronger and starts moving. The baby begins normal newborn adaptation. This is why doctors always observe the baby carefully during the first minutes. How doctors check the baby immediately? Doctors use the APGAR score, usually at 1 minute 5 minutes. They check breathing, heart rate, muscle tone, skin color, reflex response. Most babies improve strongly from minute 1 to minute 5. When should parents be concerned? If a baby does not cry immediately, it does not always mean danger, but doctors will help quickly. Doctors may provide stimulation, oxygen support, suction of airway ventilation if needed. The important thing is that the baby starts breathing effectively. BARMed summary. The first minutes after birth are a major transition. Baby stops receiving oxygen from the placenta. Baby starts breathing with lungs. Heart circulation changes. The first cry opens the lungs and helps oxygen rise. After a few minutes, the baby becomes stable and normal. BARMed advice for parents. The first cry is a very positive sign. It helps the baby breathe, stabilize, and adapt to life outside the womb. Follow BARMed for more trusted pediatric medical advice.